My specialty is orthopedic surgery. I do total joint replacements, and I try to cover all the spectrum of disease, from early interventions to try to keep patients active using regenerative medicine and new treatments, to the phase where we have to replace the joints and help them be active in another way by replacing the joints. There are three pillars that guide what I like to be and how I practice. One is patient care. So the patient is the focus, is the center of what we do. Then research. So we need to remain updated. We need to try to bring new tools to try to keep fitting that patient care with innovation and with new tools. And then the third pillar, that is teaching. Our profession is heavily embedded in teaching. We need to learn every day from our patients, from our fellow caregivers. So a combination of those three pillars is what I like to do. And I've been blessed to be working here in the Cleveland Clinic and been able to work with a great team and be able to have time to do research along with my clinical practice. The most rewarding part of my job is spending time with other human beings. Patients, of course, is a fantastic interaction and it's unique. Being able to work helping people, it's something that it's quite unique in our profession. You're really able to help, you're able to heal, or if not, you're able to stand by somebody in a moment that sometimes there are things that you just cannot change. But it goes beyond that, because as well, you get to spend time with other caregivers that have that same passion, other research colleagues. So it's a very human-friendly profession. So I think that what I enjoy is that interaction, that face-to-face, that connection that goes at so many levels.